Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM OET Institutes once again for you all. Today is Monday and we are doing reading part A today. And we are just going to discuss how to do this reading part A. So I'm just going to make this thing very easy for you in a way that you just read the questions. Like in this question, in 1 to 7, you just have to mark A, B, C, and D. So when you will get the question paper, it would be little easier to find where it is. Like the first question is asking about symptom. Second question is talking about treatment, but there is a word after treatment. Then there is a word begin the treatment. So third question is about beginning of the treatment. Fourth question is about ratio of the patients, the ones who get medical care. Fifth question is about gender wise prevalence of. So you import in final exam, what you are going to do, guys, you are just going to record this thing: symptom, after treatment. These are the words. Then you can find the paragraph A, B, C, or D, because in the final exam you will have just 15 minutes, you will not have much time, so you have to do this thing in the less time. So then the any question that you find difficult, you have to drop that question in the first round, so that in the later stages you can have more time. Like in this case, ratio of the patients who get medical care, gender wise, this is my word. So anything that talks about males, females, men, women, anything that talks about this thing. How to reduce the symptoms? Reduce the symptoms means it can be in the treatment part, otherwise it would be in the symptoms. Role of physiotherapy in the treatment. So you get almost 7 questions in the final exam. When you will take the final exam, there would be almost 4 to 5 questions which would be very easy. Only 4 to 5 questions would be very easy. 4 to 5. So these are the questions you need to target in the final exam. Okay. So I'm just putting 4 or 5. So again, now in the final exam, I have read the question, 2 questions about symptoms, but there is one thing: reduce the symptom. So it can be in the treatment part. Then there is after treatment, there is beginning of the treatment, there is gender wise, there is ratio, there is physiotherapy. So these are the keywords I have found. So now straight away, I will go to I will go to my question part. So here it is. In the final exam, it's going to be 10 times easy for you. Why? Because I have to scroll the screen, but you will have the paper. Paper is much easy to be flipped. So final exam will give you more opportunities. In my case, it is little difficult, but yeah. So the first paragraph is talking about temporomandibular joint, human body, speaking, talking about various things. Then it is talking about disorders, masticatory muscles, cases, disturbance of function, tongue, reversible, in order to prevent irreversible structural changes. So they are talking again something about reversible structural changes. Then they are talking about epidemiological statistics. Statistics means that they want to say, statistics always mean number or percentage. 70% of the randomized population suffers from at least one symptom or sign of TMD. So they are saying 70% of the population. So they are talking about the prevalence, but still they are not talking about gender. My question is gender wise prevalence. Then it is talking about 1/4 of this number, 5% seeks medical treatment. So these are the words I have noted. But in the final exam, this is even extra time. Still I will not be able to save time because I have got into the paragraph. In the final exam, I just have to do this. Okay, introduction, symptoms, talking about symptoms. One question was of decreasing the symptoms. So I would like to see if there is anything that is reducing the symptoms. Neck or shoulders, no, nothing. The TMG disorders, no. And they are saying women tend to be effective TMG orders than men. So women and men, that means they are talking about the gender wise prevalence. So it is given in B by chance. It was hard to find, but by chance I could notice this line. Then talking about diagnosis and treatment, then they are talking about x-rays, various diagnoses. Joe had this stress grinding teeth. So they are again talking about symptoms. Stress and teeth grinding are, no, they're talking about the causative factors. Then they are talking about stress reducing exercises. That means this is the initiation of the treatment. Then they are talking about treatment, series of steps, conservative options. Conservative means prevention, conserve, prevent. Then they're talking about invasive treatment might be or reduce symptoms. Again, my word is there, reduce symptoms. So in many cases, only minor may be needed to reduce symptoms. Again, I have found one more keyword. So now talking about the text D, It is about research sample 23 subjects. Again, men and women is given, but I have found that thing gender wise prevalence, so that is over there. Then they are talking about effect of treatment, then they are talking about after treatment. So I have found almost all my keywords. So if I have today frequently found symptom, it should be in B. Improvements after the treatment, after treatment I could find here, so I will do D. Right time to begin the treatment, they are talking about the time. What is the right time? So right time, I'm not quite sure. It should be over here that treatment may involve, but the time word I have not found. So still, if I do not have time in the exam, I will like to do it C. Again, I will not waste my time. What I will do, I will do it C, but I will mark it that maybe it can be wrong because I have not found the word time. So time is an important word. I have not found it completely, but yeah, improvements after the treatment, that's fine. Symptoms should be fine. Ratio of the patients who get medical care. This was hard question, but we were doing earlier. Part A, last line has been given. Gender wise prevalence, it is given in B that women have more. How to reduce the symptoms? This I have found over here. Reduce symptoms, it should be in C. Again, by chance I have found it. Role of physiotherapy, definitely over here. So out of these question, I am sure about this question. I am sure about sixth question. I am sure about second question. I am sure about seventh question. A little bit unsure about three. Otherwise, right time word should be there anyhow. I'm sure about fifth question. So I'm fifth, sixth, seventh, one, and two. So I'm already sure about five questions. One can be wrong, but five should be correct. So that is how you will find the time in the final exam. If you will do all the seven questions, suppose now if I start finding about the time, what is the right time, what is the right time, so it should be otherwise in this. Let me check where right time is given. It is used, one of the most frequently used joints. It is used when swinging to other activities day in sleep. And the term mandibular, greatest number of cases, essential to start the treatment at, it is essential to start the treatment at the stage of mere dysfunction. That is at the stage when the when the changes are reversible. So maybe this is talking about time. It is also talking about uh, time. The other thing I have found that time to start treatment. So again, really sorry to say, so that is the time to start treatment. If you will notice it nicely now, that now I have found the word begin, that is start. Now I have found it is the time to start. Right time, start the treatment. My keywords are here. I'm changing this answer from C to A. But please understand, notice this moment. Please understand, that is what you all need to learn. I have wasted my time. I could have done this later. If I would have taken a pointer, that is why you guys have that tendency that where you say, oh my sir, my timing is no. I would put a small dot over here in the final exam and will understand this question can be wrong. But I'm sure about this. I'm sure about this. I am almost sure about this. I'm sure about this. I'm sure about this. And this ratio is given in the part A, last line. So the only question that but if I do it in the initial stages, now understand, I have taken almost 2 to 3 minutes just to find one question. 8th, 9th, 10th. When I will do this question, by the time I will reach to these question 16, my time will be over. Why? Because of only one carelessness that I am teaching you, not to do all the seven questions in the first round. It will never happen in the final exam. That is the technique. That is the strategy to save your time. You can't do all the seven questions. There would be one or two tricky questions to waste your time. Generally saying, first question I did B, second question I did D, third question I did A, fourth question I did A, fifth question, let me check. I did, fifth question was B, obviously that we men and women. Sixth question C, sixth question, what did we do? Sixth question, yeah, we did C, and then we did physiotherapy D. All the questions are correct. But still, I will lose my exam. Why? Because I did this stupid question. Third, because it was tricky. Maybe if in hurry, I wouldn't have found the time, I would have done C. I have got one question wrong, but I would have done rest of the questions. But because of doing this question, I have lost out on 4 questions. So accuracy should come. I'm not saying accuracy should not be there. I'm saying time saving is the technique. Talk about these things which are easy to be found. You could have found symptom, you could have found after treatment, you could have found TMJ. This was also hard. Medicare. It was not easy. Third and fourth questions were difficult and were taking your time. So please, first thing, 4 to 5 questions would be very easy. Do those questions, go forward. Now, what is the next technique? You have learned a very important technique to manage time. Now, you have to follow the same technique until 20th question is done. Let's see. Which healthcare professional normally does the diagnosis? In which part? Yes, you are right. In the C part, because they were talking. So I just have to find the name of the professional. A dentist can help. Dentist. So dentist should be my answer. Again, again, I am just saving time. Dentist should be my answer. What is the very common symptom exhibited by TMJ? Again, it should be in the A or it should be in the B. Symptoms: dull aching pain, strength from is the most common symptom. Dull aching pain. See the see the speed. It's not taking energy. It's not taking. If I would have done third question, I would have been in hurry even doing this question. What does VS stand for based on the information given in the text? Again, I don't know in which paragraph it is. I will not do this question, but I will underline it. That I have to do this question later. I will underline this, small underline in the final exam. But till now, I do not understand what kind of a question is this, whether it is in A, B, C, or D. So I will not do it. In this question, symptom, I know A or B. B was the major. This I know diagnosis part was given in C, so I went to C. This is where you save time. What was the average age of subjects? So when we were doing this thing, we could see A or D. There was one thing. See, I was about to find subject word. That is where I noticed men and women. But in this process, by chance, I could see this. This is what save time. It should be an automatic process. Now, by chance, I have found the question number 10th and question number 11th as well. So here is the full form. That is saving of time. I did not try for it. It happened by itself. Then average age of the subjects. So I have to just check out the average age, 36.5 years. Done. So easy. Then you go into the 11th. 12th. What was the time for the inability to open or close the mouth completely? Open or close mouth should be in the symptoms or in A. But again, difficult. But again, I will notice this word. What is the term for inability to open? Otherwise, I know inability to open and close the mouth. It should be jaw lock and it should be in the symptom part. That is what you need to do. That's it. You go to the symptom and you say open and close the mouth is known as jaw clicking or popping. So this is my answer. First, you need to understand in which paragraph can it be given. That is how you will save time. Otherwise, in part A, you will never be able to control the time. If you want to control time, let's see the answers what we have done. Dentist, dental aching pain, this. And it was given jaw locking or what? Oh, this answer is given when you open the... No, this was not the answer. Jaw locking, otherwise I was thinking anyhow. This was inability to open mouth. Sorry, I went on to the wrong option. So jaw locking. My one answer is wrong just because of my carelessness. Open and close the mouth, jaw locking. That is how you do it. And then you will save time. Now let me take a couple of questions. Now I know you all have understood. Please don't get careless. Let's try few more questions because it is about taking it to your subconscious mind. So I will try and take it to your subconscious that keep doing this thing and this will save your time, energy. TMJ is one among the more regularly used dash in the body. TMJ is a joint. It's a natural blank, but it should be given in part A, first or second line generally because it looks like an introduction of TMJ. But still, I will not do it. Apart from the pain and sound phenomena, the subjects also complain. Subject means D. So I can go to this. Subjects also complained of pain phenomena and this for examined by a stone who recommended the fact. Sorry, it's not given. Study, evaluate. The research sample was compromised. With an average, they complained of pain, sound phenomena, and restricted mandibular movements. So I think there are two givens. So I have to place restricted mandibular movements, or I have to talk about pain. Yeah, subject also complained about restricted mandibular movement because pain and sound phenomena is given. That is how simple it is. By chance, I left on these blanks. What type of treatment was offered to subjects in the research study? Again, D. What does a patient suffering from TMJ normally sense the pain? What does a patient suffering from TMJ normally sense the pain? A or B? Symptom, sense the pain, or it can be in the A. So means I try to save my time. Now question, what type of treatment was offered? Let's see. Was examined, the effect of the treatment was assessed, who recommended physiotherapy. So maybe the physiotherapy was the treatment that was offered. There is no other treatment, any other treatment, any other. So physiotherapy is the treatment that I can see. Otherwise, I'm leaving this blank again because I don't have time in the. I will see. It's not treatment. What kind of treatment? Or non-invasive treatment? That is wrong. I would have done physiotherapy anyhow. So what I'm talking about is again that's where you save time, but it should be non-invasive treatment. It should be where is it? Non-invasive. Evaluate the effect of individual specific therapy. It should be this only treatment, physiotherapy. But anyhow, I don't know. Again, the process is to save time, so I will not focus on this question. Where does the patient suffering from TMJ disorder normally sense the pain? So it should be A or D. Normally word. LY words are always important. So where do they normally sense? Most frequently used joint. Activities during the day, frequency of the movement is assessed, disorders related to masticatory, it is greater number of cases, start the treatment, reversible, epidemiological, dull aching pain, severe the most common symptom, pain is usually felt in the jaw, LY word, normally, usually, felt in the jaw. That is how you do it. Please follow the base. Notice the word like frequently, normally, they help you to find the thing. Even in this question, if I have done something wrong, the previous again I'm saying that paper a question paper, that is why I always recommend pen paper based exam because they are much easy to be taken. So what type of treatment? It should have been physiotherapy. Anyhow, chalo. I don't know why any other answer is given. So TMJ is one among more regularly used dash in our body. So more regularly, it should be in A. More regularly used is one of the most frequently LY, regularly used joints. Anyhow, I was trying to do joints. So joints word, but I have to see whether joints, I have to take care of SES as well. TMJ is one among the regularly used joints. S is very important because they are saying one of the joints. Out of many joints, it is one of the joints. S word is very important. Otherwise, you will lose marks in this. Now you will say, sir, I have written joint, but it is one among the more regularly used joints. One among many joints. S word was important. Apart from this, we have done an oral guard is used to avoid. So avoid means that means if there are having some problems, oral guard is used to avoid. Let's see it again. It is a difficult one, but it should be in the treatment part. So I need either in this oral guard and I or even in this. But oral guard is a kind of a prevention technique. So it should be over here. Maximum chances are over here. Several treatments, strength wearing a mouth protector, oral guard to prevent, avoid means prevent, teeth grind. It should be my answer, I guess. Where is it? To avoid, I will fit, try and we will use to avoid that teeth grinding. Small dash may be required to reduce the symptoms. Reduced symptoms were given over here. So minor means small, non-invasive treatment. Again, easy. That is what I'm saying. You will go with these. So if you see overall until now, 13th question by chance I did wrong, but it should physiotherapy is given, so it's all good now. 13th is also good. 13th is also good. Physiotherapy word is there, but yeah, individual specific is a better word. But now the only question that I have done would have done wrong and saving time as well would have been third. Easy, 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 difficult, but I could find it. Not difficult means not that difficult. TMJ, sense the pain. Where does it was in the Joe? Maybe we did this, sense the pain. Probably we have done it. Easy, 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 easy. TMJ disorders can be dash, permanent or non-permanent, reversible or irreversible. So when they have given the word non-permanent, non-permanent means irreversible. So reversible should be my answer anyhow. I don't have to do it. I don't have to, use over energy. Non-permanent. Where was this word permanent and non-permanent? It should be over here. It can be reversible. Changes are still reversible. So reversible should be my word in this 19th answer. And now do the last question. Let's do the aching caused by the TMJ may also emanate to the, now this is a tough word, emanate. But again, please look at other words you have. Aching caused by TMJ may. Notice this grammar. When you do not understand the main word, either this word should be given, then so it's easy. Aching caused by TMJ. So aching caused by TMJ, I have to find the word ache. It should be in A. Aching, aching caused by TMJ. This is hard. Aching, but it should be over here because aching word is given. Symptoms are given. Emanate word. Usually neck and shoulder chewing. This I am unable to find. Temporary, non-permanent or chronic. So changing 19th answer to chronic. Sorry. Temporary means non-permanent. TMJ orders can be temporary means non-permanent. So chronic. So it can be chronic. If or word is given, then I will change my answer to or word is given. So I will go to chronic now. So chronic is my answer. So that is how you keep on evolving things. First answer was reversible, but that was irreversible. But non-permanent is equal to temporary. So when I could see temporary word and or word together, I will go with this one. So now I have found and may word is given, that is replaced by can. So that is how you improve the answers, by saving your time. Suppose in the final exam, sir, I did 3 questions wrong. That's okay. You did 17 questions right. But suppose if you would have done that third question in the initial stages, you would have missed out on this easy question. You would have missed out on this easy question. You might have missed out on this easy question. That is what we don't want. Easy question should be done. Difficult questions can be wrong or can be missed. 19th was difficult because it is given that way. Now, aching caused by TMJ may also emanate to the, emanate means equal to the, aching should be given it. Is usually can also be felt in the surrounding areas. So now I could not understand any word, but pain means aching, felt in the surrounding areas. Now I have found the word. If preposition in word is given, then I can say no, but to word is given, so it's not fitting in. So preposition is also an important component, that there was given in word, otherwise I would have done in the surrounding areas. So pain may also radiate to the neck or shoulders. Now I can say to the word and may word. And now I will take this chance. If it is given something caused by TMJ, may also to the, this is preposition, neck or shoulder. Now these are my answers. Now I will open up the conversation with you. Please help me and we will try to sort this reading out. Okay. So please, one by one, whatever you understand, one by one, obviously you won't be able to say one by one. What I want to ask you, what did you learn? The first thing that you learned out of this lecture. First thing. First thing.
So, like we are
Sir,
doing
should
question number
we give
1 to 7, we have
difficult
to
questions
mark
for
the
second round?
keywords first.
Okay. So first of all, pick the right words. Means in 1 to 7 questions, don't go for 1 to 20 questions. Leave 1 to 7 questions. Do 1 to 7 questions. So 1 to 7 questions should never be left. Some people think that we will start from 8. No, because it changes your mind. You have to go with the strategy where you are doing questions in a way. Again, you have to go with a certain strategy where you want to do each question up to 20th in which paragraph it is. So never leave 7 questions. Even when you're doing 8 question, 9th question, 10th question, first thing you want to check out where it is to save your time. That is what, suppose if I'm doing question number 10 and I do not know it is in A, B, C, or D, that means I will start with A. If I am doing question number 15, I'm starting with A. If I'm doing question number 16, I'm starting with A. Wastage of time. If I know it is a treatment question, I will go to that part. So that is what will save my time. Okay, first of all, do 1 to 7 questions, find the right keywords. Then, what's the next step?
Sir, if we find any question difficult, we have to leave it. We do not have to waste the time on that.
Now, Pooja ma'am from New Zealand, you are absolutely right. But difficult question means time consuming question in the reading part A. No question would be that difficult that you can't do it. It is the time we have to manage in the reading part A. Difficult means if you are unable to place it where it is, leave it straight away. We will do it later. So out of 7 questions, how many can be difficult? How many?
Just one.
Or 2? So
Yeah.
in this case, there were question number third or maybe fourth or fifth or third or fourth, which were difficult. ठीक है. What next? So you go with eighth question, ninth question in the same way. You find difficult question, you leave it. Ultimately, when if you do 15 questions, suppose you left 5 questions, you do it in 12 minutes. Now you have 3 minutes to do only 5 questions, out of which 2 questions are from 1 to 7. So now it will be easy for you. So if you do those 2 questions, 17 out of 20, and time left 2 minutes because 1 minute will be consumed. Now you have 3 questions, 2 minutes. Now you see the prepositions. Difficult questions having the change of what do we say, vocabulary. If there is a change of vocabulary, then you have to go for the prepositions. Now it is time to go for prepositions. That is how we did the last question, which was very difficult because even I don't know what is the meaning of emanate, but I know that is what I was told when I was a kid, that when you do not find the right word, that means the rest of the word will be same. Go for the grammar may, go for the preposition to the, you will find the right thing. So now with your support, how many questions are right? Let's check it out again. First was right, second was right, third was right, fourth was right, third was the most difficult. Third was right, fourth was right, fifth was right, sixth was right. All were right, right? Everybody agrees,
Ye-
please.
Yes, sir. Almost right, sir.
Almost means, ma'am,
So,
90%. Which one was wrong then? You have to be precise.
No, every every questions are right.
It is not almost, it's like all. All right. That is what you, that is, Aman ma'am, sorry, I'm interrupting Aman ma'am from UK. That is, I'm saying in a way that our words should be very precise when it comes to reading. That is what will improve our reading, because that means our mind absorbs these things. Means in the reading option, when you will do reading part B and C, all word means elimination. All means
Yes, sir.
100%. Almost can be answer, but all cannot be answer. Okay, so yeah, we will discuss that later, but this is one of the things we are learning. Dentist, dull aching pain, visual analog scale, this, jaw locking, physiotherapy I did, maybe wrong, maybe I don't know they will give marks or not, but I will try to do this. But okay, one question I'm taking wrong. Jaw, joints, S word is very important. I told you why this happened. Taj Mahal is wonder of the world. One. Taj Mahal is one of the wonders, means one of many wonders. That is what I teach you in speaking. Good morning, my name is Bhupesh. I am a nurse over here. Good morning, my name is Bhupesh. I am one of the nurses over here. When you say one of the, then you have to say nurses. Otherwise, I am a nurse here. Simple. I am one of the nurses. Both out of many nurses, I am one of the nurses. That is where this nurses word come in. So joints. Restricted mandibular because two were given, pain and this. Teeth grinding, non-invasive treatment. Chronic. This was. So two questions could have been wrong in the final exam, third and 19th and 13th maximum. I can afford two questions. So 19th, but I found it because I tried it. Reversible, irreversible. Then I found, as soon as I found temporary, then temporary is equal to non-permanent. Then you have to go for other words like or. Then you check out those words, you do these words. And this was the best one, 20th. And that means each and every, rather, if you ask me, we want 20 out of 20 if you follow the techniques, but 18 minimum we want. But that will happen if you will understand this video. And again, please guys, listen again right away if you want to pass. 2 times. One time will not change you. We are not those kind of people who change in moments. We are humans. We have our thinking. We have very strong thinking. We don't want to change ourselves. That is why please listen to this video 2 times to try and bring some changes which make your reading part a comfortable and makes it to be finished on the time. This is Dr. Bhupesh from Dr. BK Mohit Institutes. Our contact number is 76967342256. Thank you.